Welcome to the Dental Capsule. In this series, we'll cover different dental topics and real clinical situations in short, easy-to-follow capsules, designed to help us improve how we manage our daily cases.
In this capsule, we'll cover 5 important extraction advices that can significantly upgrade your extraction skills. First, respect tactile sensation. Tactile sensation is critical during extraction. While applying force, always focus on what you're feeling. Is the bone slowly expanding, or does it feel rigid, like you're hitting a wall? If you feel bone expansion, stay patient and continue. Do not rush. Rushing increases the risk of tooth fracture. But if the bone feels hard and unyielding, forcing the tooth is a mistake. At that point, change your approach and consider luxation with elevators or tooth sectioning. Second, create space before luxation. Before using an elevator, make sure there is space for movement. Use a diamond burr to remove either the mesial or distal contact, preferably the more destructed one. For example, if you luxate from the mesiobuccal line angle, remove the distal contact. This space allows controlled movement and makes luxation more effective. Third, never extract multi-rooted molars blindly. In multi-rooted teeth, especially second and third molars, always take a pre-operative radiograph. Roots can vary in number, curvature, divergence, or fusion. These variations directly affect your extraction strategy. Understanding the anatomy early helps you decide whether simple extraction, luxation, or sectioning is the safest option. Fourth, use rotational forces wisely. When you feel your grip with the forceps starting to slip, try controlled rotational movements. Rotation usually does not compromise your grip. In many cases, it helps luxate the tooth and widen the socket. Even if rotation does not lead to extraction, it rarely causes harm when used correctly. Fifth, section early in badly destructed molars. When dealing with a badly destructed molar, think about early tooth sectioning. It may look like extra effort, but starting with sectioning often saves time and energy. It is far better than waiting until the tooth fractures unintentionally. We already have a separate video that explains tooth sectioning step by step, so make sure to check it if you want to see the technique in detail. This was part 1 of this extraction series. In the next parts, we'll cover more practical tips and clinical pearls to make extractions safer and easier.
Thanks for watching. If you found this helpful, don't forget to like and subscribe. Share your thoughts or questions in the comments. We'd love to discuss them with you. See you in the next capsule.